Hi guys, today I'm going to do a short presentation on hypertension, otherwise known as the silent killer. Now, hypertension is just a medical term for high blood pressure, and this is when the force of blood pushing against artery walls is consistently too high. This causes extra workload on the heart as it has to pump the blood extra hard to get it throughout the body, and this causes the heart muscles to thicken over time, which just leads to more complications. Now, a blood pressure reading of 130/80 or above is considered hypertension, but I included a chart on the side that shows the different levels and staging of hypertension. So normal blood pressure is 120/80, but as you can see, elevated would just be just above that, 120 to 129 for systolic and around 80 for diastolic. But we get into the true hypertensive blood pressures at stage 1, with the range of the systolic being 130 to 139 and the diastolic being 80 to 89. And now stage 2, this is when the systolic is 140 or higher and the diastolic is 90 or higher. And then there's also hypertensive crisis with a systolic of 180 or higher and a diastolic of 120 or higher. And this definitely is an emergency, needs to be tended to immediately because it can drastically turn into much more life-threatening complications. Speaking of complications, this hypertension is called the silent killer for a reason, because most of the time patients don't have any symptoms. If they do have symptoms, it could be headaches, shortness of breath, very unspecific symptoms, which is the reason why it is so deadly. The increased workload of the heart increases the risk for life-threatening conditions such as heart disease and stroke, which are the two leading causes of death in the U.S., which just shows how important it is to pay attention to hypertension, because it can develop and lead to all these much more serious and life-threatening conditions that could have been prevented if the hypertension was dealt with. Now, on the side here, I just included a little chart, little graphic about some of the complications that can arise from high blood pressure, which includes stroke, headache, confusion. You can have hypertension in your eyes. You can have elevated sugars, which that can lead to diabetes, and then also it can obviously affect the heart. You can have heart failure, you can have heart attack. So these are all very life-threatening and serious conditions that can just all arise from high blood pressure. Now here's just a graphic I included just to show the effects on the heart of high blood pressure. As you can see on the left, that's a normal heart. The muscles are a normal size, but as you can see on the right over here, this is when the heart has to pump extra hard to compensate for the high blood pressure, and due to the overworking of the heart, the left ventricle, the muscle grows or hypertrophies, and as you can see, it's all compressed in here. This little canal here, the left ventricle itself, where the blood actually flows into, is now compressed. This cavity itself is a lot smaller now due to the growth of the muscle, and that's just going to lead into more complications down the line. Now, prevention is key, because hypertension is preventable unless it is secondary due to like another ailment or something. But if it's primary hypertension, this is so easily preventable strictly through healthy lifestyle choices. So a healthy diet, have a diet low in salts and saturated fats. That's really going to help. That also helps with cholesterol. That helps decrease your risk of high blood pressure. And also maintaining a healthy weight. It's very important to keep the extra weight off. That helps prevent hypertension as well as regular exercise. Now, smoking and alcohol intake are also risk factors for hypertension. So those are also recommended to be avoided. On the right over here, I just included a little graphic with just little pictures and just a little reminder of what should be avoided and done if you want to achieve a lower blood pressure. So, take your prescribed meds, sleep, manage stress, retain a healthy weight, and be active. and make sure to monitor your blood pressure regularly, because if there is a change, if there is an increase in your blood pressure, that can be dealt with and treated accordingly to prevent further complications. Now, the DASH diet is one method in particular that is used by patients that want to decrease their blood pressure. It's specifically aimed to lower blood pressure and lower bad cholesterol. Now, DASH, that stands for Dietary Approaches to Stop Hypertension. It's a flexible, balanced eating plan, and it consists of vegetables, fruits, whole grains, low-fat dairy, fish, poultry, beans, and nuts, and the limitation of foods high in saturated fats and sugary beverages and sweets. So this is basically just a meal plan to help individuals that want to maintain a healthier blood pressure and a healthier lifestyle. Just kind of like a format. It's pretty standard, just foods high in nutritional value, fruits, veggies, low fat, low saturated fat, and just having a balanced meal and a balanced diet. That's like the main idea regarding the DASH diet. And this is just another diagram putting the DASH diet in perspective, and just like a daily serving amount. So like the individual should have 6 to 8 servings of whole grains, 4 to 5 servings of vegetables, 4 to 5 servings of fruits, 2 to 3 servings of low-fat dairy, 4 to 5 servings of nuts. And it just kind of sections everything off and kind of gives individuals a more clear idea of how much of each type of food and of each food group they should be consuming in order to maximize their results and to maximize their healthy lifestyle. So the main idea is to stay proactive. Just be vigilant, maintain a healthy lifestyle, a healthy weight. Check your blood pressure regularly, because you're not going to know if there's an issue unless you know your blood pressure is high. So follow up your doctor's appointments. Make sure that you're in a healthy range. And, if you have a history of high blood pressure in your family, definitely notify your healthcare provider and your appointments about that, so they can be on top of that and aware of that. And if you're on medications regarding your blood pressure, maybe you're pre-hypertensive, make sure you're compliant and consistent with taking those meds to prevent any further complications. And you just have to stay on top of it. That's the best way you can really prevent blood pressure. Just be aware, be vigilant, and be proactive. And just live a healthy lifestyle. That's really the best you can do. So that's everything, guys. Thanks for tuning in, and I hope you enjoyed.